framework that made workers deeply vulnerable to exploitation and to employers themselves. Adult social care in England remains in a state of crisis after 14 years failure to grasp what was a system that in urgent need of reform. There are as many 2 million older people in the UK who have an unmet need for social care. And a major reason for gaps opening up in our social care system is the lack of staff. A vacancy rate in social care remains one of the highest in any sector of the economy, with more than 130,000 roles currently unfilled, and that's just in England and doesn't include other parts of the UK. And a key driver of these shortages is endemic low pay. On top of this, too many home care workers are not paid for travel time between appointments. Too many residential staff do not receive sufficient pay for doing overnight shifts. And therefore, this is why pay in the social care sector can become illegal. It doesn't meet the minimum wage requirements. And insecure employment is another problem, with around a quarter of the total workforce on 0-hour contracts, including around half of the home care workforce. And many care workers suffer from insufficient access to training, and a lack of career structure, meaning that progression opportunities remain elusive for much of the workforce. And all of this means that overseas workers are absolutely vital. While vacancies are still endemic within the UK, they have kept the sector afloat, but they don't get much thanks for this. And at Unison, we are absolutely shocked at the kind of treatment they experience. Care worker exploitation is rife irrespective of migration status, but add in the even greater power of unscrupulous employers over migrant care workers, and the conditions for the most extreme and disgraceful practices have been created. Migrant care workers are directly sponsored by their employers. And therefore, if they leave that employer or challenge that employer, then their right to live and work in this country then becomes at risk. They have 60 days to find another employer. Otherwise, they will be seen as illegally staying in the UK. Unscrupulous employers know this and seek to extract money and working hours from them, often in clear breach of the law. Care workers who blow the whistle are often victimized, dismissed, and then left destitute and at risk of deportation. It is very difficult to get enforcement action against bad employers that doesn't also penalize migrant workers. So there was a saying about, it's particularly hard for trade unions to organize when the common reason for falling out of trade union membership is leaving an employer, when at Unison, it's almost the opposite. It's at the point when they're changing employer and leaving an employer or trying to join an employer that actually our workers are most likely to turn to Unison and ask for help and support. That is the riskiest point often, because then that's when their entire right to live and work in the UK can come under massive risk. So we have published a report called Expendable Labour, which gathers together the kind of issues we found, centering the experiences of our overseas worker members, which I can share with you and whom I can give you the link to circulate to everyone at this meeting. Obviously, that goes into much more depth about the kind of experiences and issues we found than I can share in this brief talk. And Unison believes that collective sectoral bargaining, better pay, and more financial resources is urgently needed to tackle and resolve the underlying crisis in the sector, along with reform of our immigration rules. We have long campaigned for a national care service. And now that we finally have a Labour government who have put a fair pay agreement in the social care sector at the centre of a new employment rights bill, we think that there is now an opportunity to finally resolve some of these issues. The Fair Pay Agreement would be a collective employment agreement across the adult social care sector in England. It would set fair pay, terms and conditions for all social care staff, along with training standards. Its content would be negotiated between government, unions, and employers, and we think this has the potential to bring the fundamental change that's needed. And large numbers of Unison members, whether from overseas or from the UK, find working in social care hugely rewarding, but are frustrated that they are unable to make a decent living from doing so. So a successful fair pay agreement could be the route to many more social care workers seeing a future in the sector, somewhere where they can afford to continue working and where there are genuine career prospects. So while social dialogue has been extremely poor in the UK for the social care sector, Um, it's been because it's been heavily outsourced and privatized, and toxic combination of years of chronic underfunding and a dysfunctional, under-regulated market system. Um, we are hoping to turn the page, and no one needs this more than overseas social care workers. We have had high levels of recruitment as a union. We've been recruiting heavily, often through word of mouth within migrant communities. We offer free immigration advice through a specialist charity to our overseas workers. We have a network of lead staff members covering every region in the UK who take the lead on migrant worker cases. We cascade advice and guidance to our trade union regional centres and branches to advise them on how to bargain and negotiate for our migrant worker members. For us, we think it should be business as usual. Migrant workers are workers and they are members. Trade union solidarity has been the first and last principle that Unison has adopted in how we handle and resolve these issues. And we campaign for them nationally, we organize them in the sector, and we bargain and negotiate for them in the workplace. And we have found members who have great courage and who are ready to challenge their employer despite the extra risks they face. They're active in the union, they're becoming workplace reps, and we have set up a national care committee this year, and the majority of the reps are actually overseas workers themselves. They've only been in the country for a few years, and they are now already on a national committee, you know, hopefully now feeding into the discussions with government and employers about setting the terms for a better social care sector. So they are our members and they are our leaders too. And before I finish, I wanted to um, end with their voice because it's really their voices at the center of our work on this. And this was something that was said to us by a healthcare worker from India. And she said, we go through these painful experiences to work and live in the UK. Apart from paying all of these exorbitant immigration fees, our immigration status defines what kind of treatment we get. This became more visible during the pandemic. I felt that I was sacrificing my life as part of my work permit and visa application. I felt that my employer will not renew my visa if I raise a complaint. Why is it that mostly migrant health workers died of COVID? I always thought that this is racism, and indeed it is. That was her very powerful summation of what she thought her experience was, and it's one that I've heard echoed by many, many social care workers from overseas who felt that they were being asked to put themselves on the line in a way that other workers were not. Thank you.
Thank you so much. I think the quote at the end, I think, is incredibly pertinent and really important that we kind of have those voices in these spaces. And I think it's, coming from the UK myself, I know that it's an incredibly challenging sector for unions to organize and campaign in. And I think it's excellent that we've got the fair pay agreement with the new government, and hopefully, there's some green shoots of optimism that I think the rest of us internationally can really look towards. So thank you so much for your presentation. Next, we will be hearing from Kudek Park, who is the president of the Health and Care Workers Solidarity Division in the Korean Public and Transport Workers Union. This department and this union have been working hard to organize care workers, including home care workers, in cooperation with the newly formed Workers Association. Together, they lobby for legislative changes to strengthen community-based public care systems and also organize and advocate for local governments to establish public care services. Kudenk, please go ahead.
안녕하세요. 네, 저는 한국어로 발표하도록 하겠습니다. 시작하기 전에 제가 발언과 함께 미리 주신 질문에 대한 답변을 준비했는데 질문에 대한 답변도 한 번에 하면 될까요? 예, 알겠습니다. 네, 제가 살고 있는 한국은 세계에서 유례가 없을 정도로 급격한 초저출생과 초고령화로 심각한 위기 상황에 직면하고 있습니다. 요즘에 뭐 K-컬처라고 해서 한국 문화가 전 세계적으로 인기가 있다고 한국에서는 소개가 되고 있는데요. 뭐 그런 부분, 좋은 부분도 있지만 이러한 고령화와 저출생의 사회적인 대응을 잘 못하고 있는 것이 현실입니다. 이제 몇 달 뒤인 2025년이 되면 전체 국민의 20% 이상이 65세 이상 초고령 사회로 진입할 예정입니다. 10년 뒤인 2035년이 되면 노인 인구가 전체의 30%에 달할 것으로 전망되고 있습니다. 그 요양노동자를 바라보는 사회의 인식은 그 사회가 노인을 어떤 존재로 인식하는지를 보여준다고 생각합니다. 대한민국은 아동 청소년에 대한 보육, 그리고 노인에 대한 돌봄에 대해 저급한 인식과 제도를 운영해 왔고, 그 결과로 전 세계에서 출생률 최저, 노인 청소년 자살률 1위, 노인 빈곤율 1위를 유지하는 이런 오명을 갖고 있습니다. 이렇게 상황이 심각함에도 불구하고 대한민국 정부는 제대로 이 심각성을 인식하지 못하고 있고, 윤석열 대통령이 나서서 사회보장 서비스 자체를 시장화하고 산업화하고 경쟁 체제를 도입해야 된다라고 이야기하면서 사회 서비스 영역을 민간화시키고 산업화시키는 것을 가속화하고 있습니다. 현재도 한국은 장기 요양기관의 99%를 넘게 민간에서 운영을 하고 있습니다. 그래서 민간 시설에서 심각한 인권 침해와 부실한 서비스로 그 요양 노동자들이 매우 열악한 노동 조건을 갖고 있고, 이것이 사회적으로 문제가 되고 있음에도 불구하고 정부는 그 1%도 안 되는 공공 돌봄기관을 계속 폐쇄하는 정책을 쓰고 있습니다. 한국에서 1%도 안 되는 공공돌봄기관의 이름은 사회서비스원인데요. 한국의 수도인 서울에서는 서울사회서비스원을 서울시장이 폐쇄하고 거기서 일하던 300명의 요양 노동자들, 돌봄 노동자들을 해고했습니다. 그게 올해 일어난 일입니다. 그리고 올해 한국의 그 노동자들의 가장 낮은 임금인 최저임금을 결정하는 과정에서 한국의 국가중앙은행인 한국은행이 노인을 돌보는 노동자들에게는 최저임금을 주지 않아도 된다. 최저임금보다 더 낮은 임금을 적용해도 된다라는 보고서까지 발행을 했습니다. 이런 사회에서 노인이 된다는 게 도대체 어떤 의미일까요? 노인을 돌보는 일이 최저임금조차 받을 필요가 없다는 그런 사회에서 인간다운 노후는 뭐 포기해야겠죠. 그런데 이게 요양 영역뿐만 아니라 의료 영역에서도 마찬가지입니다. 윤석열 정부가 증원, 그러니까 의과대학교의 인원수를 늘리는 의대 증원을 발표하고 한국의 의사들이 의사를 늘리지 말라라고 주장하면서 올해 2월부터 파업에 들어갔습니다. 매우 심각한 일이고 이게 8개월 넘게 해결되지 않고 있습니다. 한국은 의료 대란 상황입니다. 정부는 이런 갈등을 하려는 노력이 없고 의사가 없는 자리에 의사의 업무를 간호사들이 메꾸고 있고 그 병원에 있는 노동자들의 고통과 피해도 매우 심각한 상황입니다. 이런 상황에서도 정부는 노동조합과 대화는 거부해 왔고 제가 속해 있는 의료연대 본부가 파업을 예고하면서 보건당국인 보건복지부에게 면담을 요청했고 지난 10월 17일 처음으로 한국의 보건복지부가 저희 의료연대 본부와 면담에 응했습니다. 그렇지만 이 면담은 정기적인 면담은 아니고요. 그런 사회적인 대화는 아직 한국에서 존재하지 않고 있습니다. 그러나 1차 면담이 시작이 되어서 우리 공공수노조 의료연대 본부는 이 복지부와의 면담을 앞으로 발전시켜서 사회적 대화를 할 수 있는 제도적 장치로 만들어 보려고 합니다. 네, 한국 상황은 여기까지 소개를 드리고요. 그 질문 중에 두 가지에 대해서 제가 답변을 준비해 봤습니다. 먼저 첫 번째는 장기 요양 부문에서 실질적인 사회적 대화를 위한 전제 조건이 무엇인가라는 내용이고요. 네. 그 한국에는 장기 요양과 관련해서 그 법에 근거해서 장기요양위원회라는 걸 두고 있습니다. 그 위원회는 장기요양 급여 비용을 결정하고 보험료율을 결정합니다. 매우 중요한 위원회고 그렇기 때문에 이 위원회 구성에 노동자 단체, 그리고 사용단체, 사용자 단체, 시민단체, 그리고 서비스를 이용하는 노인단체, 자영업자 단체까지 다양한 이해관계에 있는 사람들을 포함하고 있습니다. 그런데 지금 현재 정부가 들어서고 나서 위원회를 새로 구성하는 과정에서 가장 많은 노동자들이 포함되어 있는 노동조합인 민주노총을 배제해 버렸습니다. 그리고 그 자리에 친정부 성향의 노동자 단체를 포함했습니다. 그래서 그 위원회 구성에 장기 요양 업무를 장기 요양 관련해서 가입자를 대표하는 민주노총이 배제되고 오히려 장기 요양 업무를 수행하는 노동자, 죄송합니다. 배제된 상황이고요. 현장에서 활동하는 장기 요양 노동자들의 의견이 반영될 수 있는 구조가 원천적으로 차단되어 있는 상황입니다. 그래서 한국에서 장기요양 부문의 실질적인 사회적 대화를 만들기 위해서는 장기요양위원회에 민주노총 등 노동단체의 참여를 정상적으로 보장하고 장기요양 노동자들의 대표자가 참여할 수 있도록 해야 될 것 같습니다. 그리고 또 하나의 질문에 대한 답을 준비했는데요. 코로나19 팬데믹 같은 위기에 대응해서 돌봄 부분에서 사회적인 대화가 어떻게 발전해 왔냐라는 건데요. 대한민국 정부에는 경제사회노동위원회라는 기구가 있습니다. 경제부문, 사회부문, 노동부문의 대표들이 같이 포함되어서 국가의 노동정책과 경제사회 정책에 대한 협의를 하는 조직인데요. 근데 문제는 이 위원회가 노동자들을 들러리 세워서 신자유주의 정책을 밀어붙이는 수단으로만 활용되기 때문입니다. 그래서 민주노총은 들러리 설 수 없다라고 하면서 이 회의 참여를 거부해 왔습니다. 코로나 시기에도 이 경사노위라는 곳에서는 간호사를 늘리기 위해서 간호대 입학 정원을 확대하면 된다. 간호사들을 더 많이 일시키면 된다. 12시간씩 일하는 교대제를 도입하겠다와 같은 전혀 엉뚱한 정책을 내놨습니다. 팬데믹 재난 상황에서 헌신적으로 환자와 국민의 생명을 지켜온 의료 노동자들이 요구했던 내용을 완전히 무시한 내용이었습니다. 그래서 민주노총은 정부에 제대로 된 사회적 대화를 지속적으로 요구해 왔지만 코로나 시기에조차 한국 정부는 병원 노동자들과의 대화조차도 외면해 왔습니다. 한국의 현실은 이토록 어렵고 문제가 많지만 우리 노동조합은 요양 노동자들을 조직하고 제도 개선을 위한 투쟁을 계속 진행하고 있습니다. 제가 있는 공공운수노조 의료연대 본부는 사회적 대화까지는 아직 한국에서 이루지 못했지만 요양기관별로 노사교섭을 통해 단체 협약을 체결하고 노동 조건을 개선해 가고 있습니다. 오늘 국제 돌봄의 날을 맞이해서 이번 주를 돌봄의 날 주간으로 지정하고 국회의원, 보건당국, 전문가, 그리고 노동조합, 요양서비스 이용자까지 참여하는 토론회와 기자회견, 집회를 개최하고 요양 노동자들이 참여할 수 있도록 조직하고 있습니다. 공공운수노조는 어렵지만 공공돌봄 확대와 요양 노동자 처우 개선을 위한 운동을 꾸준히 해나갈 계획입니다. 고맙습니다.
Thank you, Sister Park. And I think it's an incredibly, hopefully everyone can still hear me. My internet is okay, great. I think I'm back. Thank you so much, Sister Park, for outlining the situation in Korea. I think it's really interesting to hear that perspective where you don't have official structure to engage in bargaining or social dialogue, and how different the context is for many of our affiliates around the world. In some places, particularly in Europe, we have very, structured bargaining with works councils, and we'll hear about that later. And in other places, they're just at the beginning of this journey. So I think that's a really interesting perspective to share. Thank you so much. So next, we will be hearing from two speakers from Verdi, which is the biggest union representing care workers within Germany. First, we have Matthias Grubb, who is the trade union secretary at the union, and he is responsible for the long-term care sector. Next, we will hear from Ilka Steck, who's also from Verdi. She's the chairwoman of the General Staff Council of a large non-profit provider of elderly care services in Germany. She's a registered nurse focusing on elderly care and is a member of the Federal Executive Committee of the union. So Matthias, I'll hand over to you first, and then could you hand over to Ilka, please?
Ja, ganz herzlichen Dank für die Einladung und auch die Möglichkeit, heute hier sprechen zu dürfen mit euch. Mein Name ist Matthias Gruß, ich bin Gewerkschaftssekretär bei Verdi, die Vereinte Dienstleistungsgewerkschaft, und dort auf Bundesebene für den Sektor der Langzeitpflege, also der Altenpflege, zuständig. Wie Juma schon gesagt hat, teilen wir uns den Redebeitrag so ein bisschen auf. Ich werde zunächst was nochmal zur gewerkschaftlichen Situation in der Langzeitpflege in Deutschland sagen, und meine Kollegin Ilka Steck sagt dann gleich noch was zu dem europäischen sozialen Dialog, wo wir als Verdi auch vertreten sind. Und ich glaube, Ilka wird sich gleich am besten selber vorstellen. Genau, also nochmal ganz kurz zu Verdi. Verdi ist die zweitgrößte deutsche Gewerkschaft. Wir haben insgesamt knapp 2 Millionen Mitglieder. Man muss allerdings sagen, in Deutschland ist so die Gewerkschaftsstruktur ein bisschen anders als in vielen anderen Ländern. Auch als Konsequenz aus dem Nationalsozialismus verfolgen wir in Deutschland das Prinzip der Einheitsgewerkschaft. Das heißt, wir stellen uns entlang von Branchen und Sektoren auf. Das bedeutet, Verdi organisiert Arbeitnehmerinnen und Arbeitnehmer im gesamten öffentlichen und privaten Dienstleistungssektor. Deswegen auch 2 Millionen Mitglieder. Und in diesem Bereich gibt es den Fachbereich Gesundheit, soziale Dienste, Bildung und Wissenschaft, also das gesamte Gesundheit- und Sozialwesen. Dort hat Verdi knapp 500.000 Mitglieder. Und der Bereich der Langzeitpflege ist nach den Krankenhäusern und dem Sozial- und Erziehungsdienst der drittgrößte Bereich. Und wenn wir von Altenpflege oder Langzeitpflege sprechen, dann meinen wir in Deutschland eine Branche mit 1,3 Millionen Beschäftigten, also ein sehr großer Bereich, der auch ständig wächst, weil auch wir in Deutschland natürlich eine alternde Gesellschaft haben und der Bedarf an professioneller Pflege stetig wächst. Altenpflege heißt in Deutschland auch 31.000 Betriebe. Das teilt sich in etwa 50-50 auf, also ambulante Pflegedienste, die mobil zu den Menschen nach Hause kommen und dort professionelle Pflege leisten. Und eben auf der anderen Seite nochmal genauso viele, also knapp 16.000 klassische Pflegeheime, also stationäre Langzeitpflege. Und also ein Problem, was wir haben natürlich als Gewerkschaft, auch bei der Durchsetzung unserer Interessen, auch unserer Mitglieder, ist, dass wir in dem Bereich tatsächlich nur einen Organisationsgrad von etwa 10% haben. Das heißt, der überwiegende Teil oder große Teil der Beschäftigten in dem Bereich sind nicht gewerkschaftlich organisiert. Und das sozusagen ist natürlich die Ursache dafür, dass wir viele Dinge, die wir besser regeln müssten, wo wir besser Dinge durchsetzen müssten, eben vielleicht nicht in der Stärke können, wie es eigentlich notwendig wäre, aber dort, wo wir die Beschäftigten organisieren, dort versuchen wir natürlich dann auch durch gewerkschaftliche Mittel, also auch durch Streik, und ja, das haben wir auch schon sehr erfolgreich in der Vergangenheit gemacht, dann durchzusetzen. Also 10% Gewerkschaftsmitglieder etwa. Was die Bindung an einen Tarifvertrag angeht, sind wir etwa bei 20% in Deutschland. Das heißt, nur 20% der Beschäftigten in der Branche sind an einen kollektiven Vertrag gebunden mit den Arbeitsbedingungen und der Entlohnung. Alle anderen eben nicht. Wir haben in Deutschland die Besonderheit, dass wir, ich glaube, das ist ein Unikat weltweit, dass wir neben dem weltlichen Arbeitsrecht noch das sogenannte kirchliche Arbeitsrecht haben. Das heißt, die Einrichtungen in Deutschland, die als Träger einen kirchlichen Träger haben, haben für sich neben dem weltlichen Arbeitsrecht nochmal ein eigenes Arbeitsrecht. Das heißt, sie schließen keine Tarifverträge ab, sondern regeln ihre Arbeitsbedingungen über sogenannte Arbeitsvertragsrichtlinien. Wenn man die noch mit dazu zählt, dann sind wir bei etwa 1/3 Tarifbindung. Das heißt, praktisch haben wir weit über 100 Tarifverträge im Bereich der Langzeitpflege allein als Verdi, die wir verhandeln. Das ist eine ganze Menge, aber es sind eben auch sehr viele Tarifverträge, die sehr kleinteilig sind, weil die Branche ist eben sehr kleinteilig. Viele kleine Betriebe, gerade auch im ambulanten Bereich, Betriebe mit nur 10 Beschäftigten. Das macht es sozusagen zu einer ziemlich großen Herausforderung, all diese Betriebe zu organisieren. Wir schaffen es auch nicht, in 30.000 Betrieben Haus für Haus Tarifverträge durchzusetzen. Das ist klar. Und deswegen orientieren wir auf Flächentarifverträge. Wir haben in Deutschland den sogenannten TVÖD. Das ist der Tarifvertrag für den öffentlichen Dienst. Und das ist sozusagen der Tarifvertrag, an dem wir unsere Tarifverträge orientieren und der auch in der Branche im Grunde maßgeblich ist, also an dem sich auch die Arbeitsbedingungen und Gehälter orientieren. Das größte Problem, was die Tarifbindung angeht, haben, ist der kommerzielle Bereich. Über 99% der kommerziellen Träger in Deutschland sind nicht tarifgebunden. Das heißt, dort gibt es keinen Tarifvertrag. Die Beschäftigten sind häufig kaum gewerkschaftlich organisiert und die Träger, gerade die großen Ketten, lehnen Tarifverträge ab. Und wir müssen sozusagen, wenn wir dort in die Tarifbindung kommen wollen, das wirklich über Mehrheiten machen. Das heißt, wir müssen über Organizing-Kampagnen Mehrheiten aufbauen im Betrieb und dann auch im Streik Tarifverträge durchsetzen. So, dass wir das nicht in 30.000 Betrieben können, ist klar. Der Sündenfall oder die Urkatastrophe, sage ich jetzt mal, in Deutschland ist im Grunde in den 90er Jahren passiert, also vor 30, 35 Jahren, weil dort eben der Bereich, der bis dahin gemeinnützig organisiert war, kommerzialisiert wurde. Das heißt, man hat gesagt, wir schaffen sozusagen den Bedarf nicht mehr über die gemeinnützigen und kommunalen Betriebe zu organisieren. Wir schaffen es nicht, genügend den Sektor aufzubauen und hat gesagt, wir machen das dann eben auch für den privaten Bereich in der Hoffnung, dass dann größere Konzerne, zum Teil auch inzwischen Private Equity Fonds, dort sozusagen den Bedarf decken. Und das ist passiert mit all diesen Problemen, die das nach sich gezogen hat. Und mit diesem Problem meine ich Tarifflucht. Das heißt, wir haben, wie gesagt, nach wie vor kaum Tarifbindung. Wir haben eine sehr starke Arbeitsverdichtung. Wir haben im Grunde in den Betrieben, in den allermeisten Betrieben keine Mitbestimmung. Das heißt, in Deutschland gibt es Betriebsräte, die zum Beispiel bei Dienstplänen und anderen Angelegenheiten im Betrieb mitbestimmen können. Das ist häufig im privaten oder im kommerziellen Bereich nicht gegeben, einfach weil die Arbeitgeber versuchen, dagegen zu arbeiten. Durch Union Busting und andere Sachen. Und in den tarifgebundenen und in den AVR-gebundenen Betrieben ist die Situation deutlich besser, aber auch dort noch weit weg von perfekt. Also auch dort haben wir die Probleme, dass wir hohe Krankenquoten haben, dass wir eine sehr hohe Fluktuation in den Betrieben haben, dass die Dienstpläne unverbindlich sind, weil die Kolleginnen und Kollegen aus dem Frei geholt werden. Das heißt, ne, wenn sie sich ein Wochenende frei planen, bekommen sie kurzfristige Anrufe, dass sie einspringen müssen und dergleichen. Also das sind Probleme, die gibt es nahezu in jedem Betrieb in dem Bereich. In den vergangenen Jahren kann man in Deutschland eine verstärkte Bemühung beobachten, auch von der Politik, mit dem politischen Weg dran zu gehen, durch neue Gesetze. Das heißt, wir haben seit jetzt 2 Jahren den Versuch, ein neues Personalbemessungsinstrument zu implementieren, was auf pflegewissenschaftlicher Erkenntnissen beruht. Wir haben seit einigen Jahren den sogenannten Pflegemindestlohn, also Mindestlohn, der nur für den Bereich Pflege gilt, der die Gehälter steigen sollte. Und wir haben seit kurzem, seit 2 Jahren knapp, die sogenannte Tariflohnpflicht. Das sind Bedingungen, die Betreiber erfüllen müssen, damit sie überhaupt die Zulassung kriegen, in dem Bereich aktiv zu sein. Das heißt, sie müssen eine Mindesthöhe einhalten in der Bezahlung ihrer Mitarbeiter, die sich an Tarifverträgen orientieren. Das hat nicht zu mehr Tarifbindung geführt, aber zumindest zu höheren Entgelten. Wenn man das Ganze runterbricht, lassen sich am Ende 2 große Probleme feststellen. Das eine ist der Pflegekräftemangel. Das heißt, wie auch in anderen Ländern oder auch wie die Kollegin gerade aus Südkorea berichtet hat, haben wir das gleiche Problem. Wir haben eine alternde Gesellschaft und gleichzeitig zu wenig junge Kolleginnen in dem Beruf und in der Branche, die sozusagen diesen wachsenden Bedarf decken können. So, das heißt, wir versuchen in Deutschland inzwischen sehr stark auch über Anwerbung von ausländischen Kolleginnen, gerade auch aus Osteuropa und auch aus Fernost, von den Philippinen, aber auch aus Südamerika und Mittelamerika, Kolleginnen anzuwerben, aus Mexiko auch. Aber das kann bei weitem nicht das decken, was eigentlich notwendig ist. Also da gibt es eine sehr große Diskrepanz und das stellt die Gesellschaft in Deutschland vor sehr große Herausforderungen. Und der zweite Bereich nach dem Pflegekräftemangel ist die Finanzierungsfrage. Also in Deutschland gibt es zwar eine Pflegeversicherung, die die pflegebedingten Kosten abdecken soll, aber sie ist eben nur eine Teilversicherung. Das heißt, sie kommt nicht für die gesamten Kosten auf, was am Ende bedeutet, dass die Pflege in den Pflegeheimen in Deutschland inzwischen kaum noch bezahlbar ist. Also die Renten sind nur halb so hoch, wie ein durchschnittlicher Pflegeheimplatz kostet. Und wie diese Lücke zukünftig gefüllt werden kann, das ist gerade so das große Thema in Deutschland, weil ja, im Grunde die Pflegeversicherung jetzt schon pleite ist und die Kosten eigentlich nicht weiter steigen können. Also das ist gerade so das, was umtreibt. Und für uns als Gewerkschaft heißt es natürlich im Betrieb, jeder Euro mehr, den wir an Gehältern durchsetzen durch die Tarifverträge und jede Person mehr, die angeworben wird und die sozusagen über den Pflegeschlüssel hinaus angestellt wird im Pflegeheim, verursacht höhere Kosten für die Menschen, die dort versorgt werden. Und das ist sozusagen das Dilemma. Seit einiger Zeit gibt es, das habe ich eben schon angesprochen, auf europäischer Ebene den sozialen Dialog, also nicht auf nationaler Ebene, sondern auf europäischer Ebene. Verdi ist dort Teil, auch über unseren europäischen Dachverband, über PSI. Und Ilka Steck, meine Kollegin, ist dort Mitglied für Verdi und Ilka wird jetzt gleich noch ein paar Sachen zum europäischen sozialen Dialog sagen. Und dann sind wir natürlich hinterher auch noch gerne offen für Fragen. Ilka.
Super, danke, Matthias. Vielen Dank auch, dass ich hier sprechen darf. Ich finde es schon super spannend, bis hierher aus diesen anderen Ländern zu hören. Wie schon vorgestellt wurde, ich bin Altenpflegerin seit nun 30 Jahren und einem Monat. Am 1. Oktober 1994 habe ich meine Ausbildung angefangen. Und ich arbeite bei der Diakonie in Süddeutschland. Ich bin jetzt als Betriebsrätin, also in der Kirche heißt es Mitarbeitervertretung, beschäftigt und eben bei Verdi auch schon ehrenamtlich aktiv, viele, viele Jahre, um die Bedingungen in der Altenpflege zu verbessern. Seit letztem Jahr darf ich mich einsetzen bei dem sogenannten sektoralen sozialen Dialog für soziale Dienste in der Europäischen Union. Und die sozialen Dialoge, da gibt es sehr viele in der Europäischen Union, auch für Chemie und Post und so. Und dieser soziale Dialog für soziale Dienste ist der neueste, der ist seit Dezember 23 eingerichtet. Und wir als Verdi sind dort vertreten mit 2 Ehrenamtlichen, also ich bin mit dabei und eine Kollegin, die hauptamtlich bei Verdi beschäftigt ist. Und die Gewerkschaft, also da in diesem sozialen Dialog werden die über 9 Millionen Beschäftigten in den 27 EU-Ländern vertreten. Und durch die Gewerkschaftsseite ist vor allem EPSU, so wie Matthias schon gesagt hat, die Gewerkschaft für den öffentlichen Dienst, die europäische Gewerkschaft. Und die Arbeitgeber sind die Social Employers und wir sitzen zusammen, Arbeitgeber und Arbeitnehmervertreter aus allen möglichen EU-Ländern, um Dinge zu beraten und Stellungnahmen zu erarbeiten, Richtlinien zu erarbeiten, die dann der Europäischen Union vorgestellt werden und gegebenenfalls von ihr in eine Richtlinie gemacht wird, die dann von den Ländern umgesetzt werden muss. Das ist natürlich unser großes Ziel, hier auch in ganz Europa Verbesserungen zu erreichen durch diesen sozialen Dialog. Der soziale Dialog für soziale Dienste kümmert sich vor allem um die Themen frühkindliche Erziehung und Langzeitpflege. Also das ist unser sozialer Dialog. Und wir sitzen dreimal im Jahr sind Sitzungen, aber vieles wird in Ausschüssen bearbeitet, die sich schon öfters treffen. Nächste Woche ist eine Sitzung in Präsenz in Brüssel und dort soll dann ein Aktionsplan für die nächsten 4, 5 Jahre abgestimmt werden mit den Arbeitgebern. Die Europäische Union ist ja froh, wenn schon etwas, das abgestimmt ist zwischen Arbeitnehmern und Arbeitgebern, bei ihm ankommt, dann wissen Sie, da ist die Sozialpartnerschaft damit einverstanden. Aber Sie können sich vorstellen, wie schwierig das ist. Wie schwierig es schon ist, im eigenen Land sich mit dem Arbeitgeber zu einigen. Und jetzt haben wir 27 Nationen. Da sitzt dann Polen und Irland und Deutschland, Spanien, Portugal und dann aus jedem Land Arbeitgeber und Arbeitnehmer. Also es ist eine sehr hohe Flughöhe, kann man sagen. Also es wird viel, also nichts Konkretes, wenn ich das so sagen kann. Wir momentan, was mir sehr wichtig ist in diesem Programm, das gerade hier erarbeitet wird, ist der Umgang mit den psychischen Belastungen, die Gewalt durch Dritte in an unserem Arbeitsplatz. Hier soll eine Einigung gefunden werden mit den Arbeitgebern und dann, dass europäisch eine Richtlinie verabschiedet wird, dass wir als Gesundheitsarbeitnehmer besser geschützt sind durch diese Gewalt, dass unser Arbeitgeber sich verpflichtet, uns besser zu schützen. Genau. Spannend ist wirklich, dass die großen Probleme überall gleich sind. Wir haben es jetzt auch schon aus Korea und aus UK gehört. Anders ist es nicht in den europäischen Ländern. Auch in Tschechei zum Beispiel haben sie die Bevölkerungsentwicklung mit vielen alten Menschen und so weiter. Ich finde es ganz arg gut, dass wir als Gewerkschaft auf dieser politischen Ebene mitreden dürfen, dass wir als Beschäftigte unsere Sichtweise einbringen können in die Verhandlungen und die Europäische Union diese sozialen Dialoge geschaffen hat, um von der Basis zu hören, was braucht es für Regeln. Also das sind die sozialen Dialoge, wo ich teil sein darf und ich hoffe, ich konnte einen kleinen Einblick geben und ich bin auch noch da, wenn nachher irgendwelche Fragen sind. Vielen Dank.
Thank you so much, Ilka and Matthias. I think it's incredibly important, the information you shared, and particularly that how big the sector is within Germany, and only 20% of that sector is in a collective bargaining agreement. I think it's really interesting, and it shows that, you know, the hurdles that unions have to overcome to really organize these workers, and also the low levels of unionization within this sector. That's something our affiliates have been telling us all around the world, is that, you know, they're struggling to get the workers to join a union, to kind of trust the union, to understand why the union is important. And I think employers really thrive off that and really kind of exploit that. So thank you so much for both of you for your presentation. Now we will be hearing from the ILO. We'll be changing tracks a little bit. We'll be hearing from the ILO, and then we'll be hearing from one more affiliate. Our last affiliate is based in California, so because it's very early there, we very kindly have put them last. So we're going to be hearing from the ILO, and then we have one more affiliate, hopefully. But as many of you will know, PSI and our affiliates participated in the recent International Labour Conference. Many of you who are here today were there with me for those very long 2 weeks, where there was a general discussion on decent work within the care sector. Well, from that tripartite process, the ILO has proposed an action plan to its governing body for adoption. The governing body is going on right now. Within that plan, there are multiple references to social dialogue and collective bargaining. We are very lucky to have with us today Maren Hopp, who is the technical specialist in the health services sector in the sectoral policies department at the ILO. She's here to share with us the work being proposed in the action plan and wider within the ILO to support social dialogue and collective bargaining within long-term care. Maren, please go ahead.
Thank you very much, Yuma. Hello, everyone. Thank you very much for the invitation. It's a great pleasure being here with you today. I've been very, very interestingly followed all the previous presenters and the situation, and I share the observation that it seems that the big problems are very common in all the countries. So I prepared a little presentation. Let me see if I can share that. Just to have some visuals in between. I'll put that in presenter mode. Can you see that? Wonderful. I get a thumbs up from you, Mar. Thank you. So as Huma already mentioned, 2024 was a very important year for the care economy here at the ILO, with our 112th session of the International Labour Conference, which had a general discussion on decent work in the care economy. And as was mentioned, that it's already very challenging to find consensus at the European level. It was also very challenging to find consensus at the international level, but our constituents, and I know that PSI was very actively engaged, came up with some very strong conclusions concerning decent work in the care economy, which has a clear call for the ILO and in consultation with constituents to strengthen all forms of social dialogue, to encourage effective workplace cooperation, to ensure safe and productive workplaces that respects collective bargaining and the outcomes of it, and that do not undermine the role of trade unions. So that's paragraph 31 of the conclusions, a very strong call. And throughout the discussions and also throughout the rest of the conclusions, it becomes very, very clear that voice and representation are actually key to addressing some of the major challenges, including fragmentation in the broader care economy, but also long-term care, healthcare, etc. As it's often provided at the intersection of health, of social care, in communities, in facilities, there is often a lack of coordination, of clear guidance of who is responsible, which leaves the sector highly fragmented. So ensuring that everyone has a voice and bringing everyone together for dialogue, and then having social dialogue, tripartite social dialogue, also supports ensuring that there is policy coherence that is responsive to all the diverse and specific needs of those who provide care and those who receive care. So it's of course not the first time, it's not the first call for strengthening social dialogue in the system. We've been working on supporting social dialogue and consensus building in the health sector for a couple of years, and I would like to share some of our work at country level with you that we've been doing in the past 4 years, 4 or 5 years prior COVID and during COVID. And one of that is that we actually did, in collaboration with our International Training Center in Turin, we conducted online training course on social dialogue in support of sound labor relations in the health sector. We did that for constituents in the occupied Palestinian territories in 2022 and in Kenya. And the training actually included sessions on approaches to negotiation, on approaches to bargaining. It touched upon different bargaining methods, positional bargaining, needs-based bargaining, etc. And the participants of the training actually were requested to come up with an action plan or roadmap on how to strengthen social dialogue in their specific areas of work. In Kenya, we are continuing our support and supporting social dialogue and sound labor relations. As you might know, there is a lot of strike ongoing at the moment and in previous months. So we are supporting the development of a very practical handbook for social dialogue in the health sector. This is supported by a tripartite working group that brings together experts from health and labor in Kenya, which is sort of, a combination of a sort of a landscape analysis of our situation analysis of who are the institutions, who are the constituents, who are the players, who are the stakeholders, what are the mechanisms in Kenya in the different at national level, but also at county level, and then very practical steps towards what needs to be done in order to implement and to strengthen social dialogue, whom to include, how to set up the meetings, what are possible topics to discuss, a very practical step-by-step guide on what to do. We're still in the process of developing it, and we're hoping to be able to share that with the constituents in Kenya early next year. During COVID, we also did a lot of training on occupational safety and health in the sector. But we combined that due to the request of constituents in Mauritania and Chad with sessions on social dialogue, on strengthening social dialogue, but also where we had training, particularly on occupational safety and health. We're using an approach which is called the ILO WHO HealthWise approach, which actually encourages health facilities to implement and to support and to develop bipartite workplace OSH committees, and we're following up with a lot of the health facilities to continue our support that these committees are actually well functioning and that there is continuous dialogue at health facility level. One consensus building activity that I would like to share with you as well was our tripartite technical workshop in the SADC region, where we brought together constituents from the SADC countries to discuss health and employment and decent work challenges in the health sector. We also brought in the health experts, so ministries of health, and it was quite interesting to see because oftentimes labor, coming from a labor perspective, but also coming from a health perspective, sort of we talk about the same issues, but we use slightly different terminology, which, you know, if you engage in dialogue, you get a better sense of, you know, what some other people are talking about. Same with the financial people. So it was really a very interesting dialogue. And we had very strong conclusions coming out of this tripartite meeting, tripartite technical workshop. And these conclusions actually supported the development of the SADC Health Workforce Strategic Plan 2020 to 2030, which was adopted by the Ministers of Health from the SADC region. And it includes a key milestone that says that by 2027, member states will have to institutionalize social dialogue mechanisms among governments, workers and employers and other relevant stakeholders. And it further also fosters or calls for strengthening policy coherence between labor policies in the SADC region and health policies, particularly health workforce policies. So that, I think, was a very interesting or very good example of bringing together and fostering dialogue, also to break down silos that we often are facing in the sector. Now, Huma mentioned it. What is the follow-up? We're not stopping here. Of course, we continue to support and strengthen and promote social dialogue. In concerning the conclusions that were adopted in the International Labour Conference, the office in consultation with the constituents actually drafted a proposed plan of action that will be giving effect to the conference resolution. And that plan of action will be discussed at the ongoing governing body. It's on the agenda for discussion and adoption, hopefully next week, Thursday, if I'm not mistaken. And that action plan recognizes the centrality of the rights-based approach and the importance of social dialogue. And it has a particular component on international labor standards and social dialogue, which actually looks into conducting research on key challenges, on key barriers for the effective exercise of the right of freedom of association and collective bargaining. But it also looks into strengthening constituents' capacity to develop sectoral international labor standards, codes of practice, and sector-specific tools that also foster social dialogue. So I stop here. I thank you for your attention and of course remain available for any questions. Thank you.
Thank you so much, Maren, and thank you for kind of outlining what the process is going to be with the conclusions and the draft action plan. Obviously, we know with the ILO, they work at a tripartite level, but I think we've heard some affiliates, particularly our colleagues from Korea, when they're talking about how governments have an active role to play in social dialogue, and the environment that they're setting and kind of the legislation that they're implementing is really important, that we encourage them to be as friendly towards workers, particularly within this sector. So thank you so much. So hopefully our last speaker is joining any second now, but before I pass on to our final speaker, Doug, I really wanted to quickly show something else PSI has produced today. Obviously, we know it's the International Day of Care and Support. And so we've partnered up with our colleagues at Education International to publish a fact book looking specifically into privatization in early childhood education and childcare and children's social services. So we really wanted to produce something so our affiliates could have this information so they could see how financialization and privatization has expanded within this vital sector and what unions can do with this information and how they can kind of push back. Hopefully my colleague Florence has just put it in the chat. Please, I really encourage everyone to take a look and to share it and to really share it wide amongst your network to show that this is an issue within the sector. And this fact book will hopefully be the first kind of expansion of PSI's work within childcare. So Arida or Florence, I don't know if our colleague Doug has joined.
Not quite yet, no.
Yeah, so I think any second now. But I wanted to ask, whilst we wait for our colleague Doug, maybe we could take some questions. If anyone has some burning questions that they would like to ask our panel, or perhaps we can kind of open it up to the rest of the audience to see if they have any questions to ask any of our panel. So please feel free to put your hand up, to put something in the chat if there's anything that you would like to get further information on that you've heard from today. Is there anything you would like to share from your union or your affiliate? If you put your hand up, I think you go straight to the front. Cyril, my colleague Cyril, please go ahead.
Oui, bonjour Rouma, bonjour tout le monde. Ce serait plus une intervention en complément de ma reine de l'OIT. J'étais à la conférence internationale du travail en juin pour aider à préparer les conclusions sur l'économie du soin et le travail décent. Et c'est vrai que cette semaine, il y a le conseil d'administration et je crois que c'est ce mercredi 6 novembre que sera à l'ordre du jour le plan d'action qui découle de ces conclusions. Les négociations ont été terriblement difficiles hein, quand même avec les employeurs. Hein. On a l'impression que tout s'est bien passé. Non, ça a été très, très compliqué. Les employeurs ont fait une résistance farouche à un grand nombre de points de l'économie du soin, notamment sur la reconnaissance du dialogue social, sur la reconnaissance des difficultés que vivent les travailleurs et notamment sur les conditions de travail qui font que les travailleurs de la santé quittent le secteur. Voilà, les employeurs ont déposé plus d'une centaine d'amendements. Donc, ils ont coupé les cheveux en 6 dans le sens de la longueur constamment. Ça a été une bataille sans relâche. C'est vrai que la Confédération syndicale internationale a beaucoup travaillé avec des séances de négociation qui ont duré tard dans la nuit, on pourrait presque dire tôt jusqu'à tôt le matin. Donc ça a été des séances de négociation particulièrement compliquées. D'ailleurs, quand on regarde le plan d'action, j'espère qu'effectivement, il pourra refléter fidèlement les conclusions. Pour le coup, pour l'instant, c'est le cas, si ce n'est dans l'historique et le contexte, n'est pas assez mis en avant la carence d'effectifs et cette pénurie d'effectifs qu'on retrouve au niveau français, européen et mondial, alors que c'était pourtant un point sur lequel tout le monde était d'accord. Et cette pénurie d'effectifs, on le voit, appelle à des comportements des pays, soit qui font appel à des travailleurs étrangers et à ces problèmes de migration autour des travailleurs de la santé. C'est une réponse totalement insatisfaisante. La priorité devrait être de meilleurs salaires, de meilleures conditions de travail et rendre le secteur attractif. Donc voilà, c'était C'était plus un complément d'information. Tous les organismes internationaux s'y mettent hein, sur le secteur de la santé. C'est dire si on peine à faire avancer cette problématique. L'OMS y est depuis très, très longtemps. Malgré toutes les recommandations, la situation continue de se détériorer. Le comité santé de l'OCDE aussi, hein, il met du sien depuis de nombreuses années. Maintenant, c'est la première fois qu'en juin, l'OIT se penchait sur la problématique. Espérons que pour le coup, ça fasse véritablement avancer les choses. Il manque des législations contraignantes, il manque une vraie volonté politique, il manque des financements et on est loin d'avoir tiré les leçons de la pandémie. Donc voilà, on peut se réjouir effectivement qu'il y ait un travail qui avance, mais tout ce qui a été fait préalablement n'a pas véritablement amélioré la condition des travailleurs du soin et de la santé. Donc je voulais juste peut-être réfréner l'enthousiasme général à dire que le chemin était encore long. Voilà, ce n'est pas vraiment une question, c'est plus un constat qui me fait beaucoup de peine quand on voit les besoins de prise en charge et les difficultés de ces travailleurs de la santé. Voilà, je ne sais pas si Marraine peut commenter ce que j'ai dit, mais je rappelle que les négociations ont été vraiment douloureuses avec les employeurs qui se sont montrés particulièrement difficiles, voire arrogants, voire parfois méprisants à l'égard des travailleurs, du groupe des travailleurs que nous représentions. Merci en tout cas à toi, Ouma, et au plaisir de revoir tout le monde.
Thank you so much, Cyril. And I think our interpretation cut off a little bit at the start, but just to say that Cyril is from Cerf de Terre, which is one of our big unions in France, and they've been doing a huge amount in long-term care. You may have seen the scandal in Orpea. They were instrumental in kind of exposing that, but just in case the interpretation cut out. Thank you so much, Cyril. So I think we have another question from our brother Pappy. Please go ahead.
So basically, I would like to comment on the conversation with the Unison person on exploitation of workers in the UK. It's something that is quite big for us as well in GMB. And similar to what they've got as well, we've got the National Care Committee. And this is part of the conversations that we've been having the last few weeks and months. I would like to know what UNICE is doing and to know if there's room for inter-union collaboration so that sometimes we could pull energies together and get the same result and minimize, optimize resources instead of having to do about the same thing, if that's a possibility. Then secondly, with regards to the issue that she talked about in terms of workers' rights. So we've had a situation where someone was sacked by an employer and they just had 60 days to stay in the country. Obviously, that's an immigration situation. However, even though it's immigration, it's also got employment rights in it, because you've got this person who's not got a chance to go to an employment tribunal to explain what's happened. So in that moment, they've just lost a job, and then at the same time, they have to leave the country. I know it's quite a very difficult one because it's immigration, obviously. At the same time, it's employment. So in terms of reform towards immigration or migration rules, what role can unions play to be able to influence this particular rule to make a change? Thank you.
Thank you so much. And it's great to hear that colleagues from GMB are on this call. I think, you know, the UK is kind of a quite difficult situation for care workers and the mass privatization that's gone on within the sector. And I think, you know, unions working as closely as possible, I think is very important. I don't know if any of our speakers would like to answer the question or if there's if any of our speakers would like to respond to that question or to any of the questions that we've seen. I've just received an email. I have a very, well, not so exciting update. Unfortunately, Doug, a comrade from the US, who is for UDW, is not feeling well, and he's not sure if he's able to join. It's quite early in California, so I think that we might struggle to get Doug on the line, but I will continue trying. Namada, do you want to take the floor quickly?
Just to quickly respond to that issue, I do work closely with other trade unions, including the GMB, and we meet with civil servants regularly to explain the issues being experienced by our members, especially about that space between immigration rules and employment rights. There's a gap, which is where the experience and the exploitation of our members happens. So we use our trade union bargaining and negotiating skills to try and get a better result with employers. And we use our campaigning voice in Parliament to try and get legislators to resolve this issue. It's an issue for them, but a crisis for our members.
Thank you so much. And yeah, I can attest to the unions working together. Narmada and I actually worked together when I was in a UK union, and we would have meetings regularly to make sure that if there were any, issues and coming up in terms of legislation, that unions were united in kind of pushing back, particularly with our situation when we had a very right-wing, slightly insane government. Matthias, please go ahead.
Ja, also ich würde jetzt mal für Deutschland sagen, dass das Problem gar nicht mal ist, dass die Regulierung oder die Gesetze das Problem sind, denn die sind ja, mal neutral betrachtet, in Deutschland gar nicht so schlecht. Wir haben eher das große Problem, dass die Gesetze nicht eingehalten werden. Und was bringt mir sozusagen der beste Tarifvertrag oder das beste Agreement oder das beste Gesetz, wenn am Ende die Arbeitgeber ja drauf scheißen und einfach sagen, das missachte ich. Und wenn dann sozusagen niemand da ist, zum Beispiel Betriebsräte, die dem nachgehen, ja, dann haben wir genau die Ergebnisse, über die wir gerade sprechen, nämlich dass es eine Missachtung von Menschenrechten gibt und dass ja, uns am Ende auch als Gewerkschaften immer nur übrig bleibt, dann zu reagieren, zu beraten und zu unterstützen, wenn meistens das Kind schon in den Brunnen gefallen ist, also wenn das Problem schon besteht. So. Und das ist ein großes Problem. Wir haben seit einiger Zeit, ich weiß das Datum jetzt gar nicht mehr genau, in Deutschland ein sogenanntes Whistleblower-Gesetz. Das heißt, die Träger müssen sozusagen die Möglichkeit schaffen, dass man auch Informationen über Missstände melden kann, anonym melden kann, damit eben genau dieses Problem angegangen werden kann, dass eben, wenn Missstände irgendwo sind oder Gesetze missachtet werden, dass dann auch entsprechend strafrechtlich verfolgt werden kann. Aber das ist so eine Sache, die wir sehr oft sehen. Wir sind sehr gesetzesgläubig, glaube ich, in Deutschland. Wir machen Gesetze zu etwas und gehen davon aus, dass sich jeder daran hält. Und leider müssen wir feststellen, dass das eben nicht immer der Fall ist. Eine zweite Sache, die ich noch ansprechen wollte, die jetzt, glaube ich, heute so noch gar nicht Thema war, was auch eine Sache ist, die uns beschäftigt. Und dann sind wir nämlich in dem ganzen unregulierten Bereich. Das ist das Thema der 24-Stunden-Live-In-Betreuung. Also wir haben in Deutschland schätzungsweise etwa 500.000 Menschen, überwiegend Frauen, auch aus Osteuropa vor allem, die in Privathaushalten rund um die Uhr arbeiten. Und das ist häufig eben nicht reguliert. Dafür gibt es keine gesetzliche Grundlage. Denn wenn die gesetzliche Grundlage ernst genommen würde, dann könnten sie dort nicht 24 Stunden arbeiten, ne? Weil wir haben in Deutschland eben ein Arbeitszeitgesetz, was genau das ausschließt. Aber an dieser enormen Zahl von 500.000, manche reden sogar von noch mehr, wird schon deutlich, wie ernst dann auch die Arbeitszeitgesetze und so weiter genommen werden. Also das ist ein großes Problem. Und das passiert eben im Dunkeln. Das ist sozusagen stillschweigend. Häufig haben die Beschäftigten dann da auch kein Interesse, dass das irgendwie thematisiert wird, weil sie auch abhängig sind und auch auf das Geld angewiesen sind, was sie häufig dann auch nach Hause schicken zu ihren Verwandten. Ja, und das ist so ein Thema, da fehlt uns momentan noch so ein bisschen die Idee, wie wir das anpacken können. Weil, ja, wir wollen es einerseits nicht legalisieren, weil das, was so passiert, ist Leibeigenschaft, das ist Sklaverei. Auf der anderen Seite, wenn es nicht reguliert wird, passiert es trotzdem. Und da ist so ein bisschen, das fühlen wir uns ein bisschen, dass uns die Hände gebunden sind. Ich weiß nicht, wie das in anderen Ländern aussieht. Ich gehe davon aus, dass das häufig auch in anderen Ländern vielleicht der Fall sein wird, dass es eben diesen dunklen Sektor gibt von 24 Stunden Living.
Thank you so much, Matthias. That actually would have fitted in really great if our colleague Doug was able to make it. Doug is the executive director of United Domestic Workers, which is an affiliate of ASME, which is the big US union. And I think they represent over 140,000 in-home care providers. And I thought that was a really important perspective that we should share at this event, because it's not, long-term care does not just encompass workers in formal kind of settings such as residential homes, but it's a huge amount of kind of people who are traveling to different homes to provide care. So unfortunately, I've just had confirmation that Doug is feeling unwell and is unlikely to join us today. These things happen, but I think hopefully next time we can get that perspective, because I think it's a really important perspective to have. Maren, before I quickly go to you, I have a comment and question in the chat that I just want to quickly share. And hopefully some of our speakers can respond to this. This is from Sung Hee, who is from KPTU, the Korean Public Transport Workers Union. And she has asked, in Korea, some unions are calling for a separate law to specifically guarantee the rights of care workers. I wonder how other countries guarantee the rights of care workers in legislation or other institutions. I'll go to Maren quickly so she can say her comment, but if the other speakers would like to think about how they can respond to that question, please go ahead, Maren.
Yes, thank you very much. I was just quickly wanted to react to the issue that Matthias Gruß raised from Verdi. I think it's as he mentioned, it's a very big challenge to ensure that those workers working in private homes and have access to or are able to exercise their labor rights. I think one that's now, sort of that came to my mind, and that's around for a while, especially since COVID, is also the issue of occupational safety and health for those workers in private homes, especially under the current or under the fact that now a safe and a health work place and work environment is a fundamental principle and right at work. So I think there is also a lot of opportunity to, I know that workers providing care in private homes, live-in workers have a lot of different challenges and decent work challenges, and one of that is occupational safety and health. But from that angle, it could be very interesting to see how we can strengthen occupational safety and health, which actually includes working time and other aspects for those workers. We do have, but also infection prevention and control, etc. We have a very good guidance and tools that are basically majorly targeting health facilities or residential homes, but as the overall health system is looking more and more into providing care in the community, into keeping patients and care recipients at home and they're private, keeping them independent as long as possible, that also poses challenges to the workers who are providing the care with regard to keeping them safe and labor rights. So under this perspective of occupational safety and health and safe work environment being a fundamental principle and right at work, I think that's a very interesting discussion where it would be very interesting to follow up on. Thank you. Yuma, back to you.
Thank you so much. I just wanted to check with our panelists if they had any responses to Sung Hee's question, specifically about how other countries guarantee the rights of care workers in legislation or other institutions, and whether those legislations are actually enforceable and effective, I think, because in lots of countries, I think we have that legislation and we have, mandates from the ILO, but whether on the ground they're enforceable and make a difference to care workers, I think it will be interesting. Because I think in lots of cases, just for example, in the UK, we have minimum wage legislation, but there's huge amounts of kind of violations against minimum wages from many big corporations and companies. So despite having legislation how enforceable is that for care workers? Namada, please go ahead.
Thank you very much. I was just about to say, it is about how do you have enforceable rights, because my overseas workers in the UK are supposed to have all the rights that everyone else does. It is simply being in a position to be able to challenge the employer without taking a massive risk. So one of the things we are asking from the government is to no longer have that power given to employers, that actually that the visa sponsorship should be with the government and the Home Office rather than individual employers. And therefore, you can move employers more easily, and you don't have to rely on the goodwill of your employer not to be threatened for everything in your life, really. So I think that, where what we find is we address one thing and then a new problem crops up. That's because of the way immigration works in the UK. But I think this would be an important step forward.
Yeah, thank you. I completely agree that, and there's also a lack of investment in kind of enforcement agencies, that lots of workers, who aren't unionized don't really know what the kind of situation is or where they can go to when they're not having access to their full legal rights. If anyone has any final questions, please do put your hand up. We are probably getting towards the end of this session. If nobody has any further questions. Great. Perfect. Jen, super quick, so then we can wrap up.
I think, Jen, you're on mute.
Sorry.
Jen, can you hear us?
Yes, I'm very sorry. Yeah, my name is Genevieve Gencianos, and I also work with Huma in our health and care team, and I'm the policy lead on migration. And thank you very much for the presentations here. And first of all, just to flag that next week on the 6th of November, we're also going to have our global consultation on the migration of health and care workers. And I am very much impressed with the examples that Narmada, for example, has shared about how they're using social dialogue in fighting for non-discrimination for migrant care workers. So we want to surface these good practices and also exchanges, but also looking at the recruitment from overseas, which is also what the WHO Code of Practice covers. And hopefully in the discussion next week, we will be able to exchange on that and really learn from each other. Also noting that Verdi, for example, also highlighted that the shortages and how governments are really recruiting from overseas. So just wanted to share that, and then we're very happy to connect all these dots and to be able to work with you all in the health and care sector and how to address these important issues. Thank you. Thanks, Huma.
Yeah, thanks, Jen. If you have the link, sign up link to the event, please do share it in the chat. I really encourage everyone to join. The migration in long-term care is a new emerging pathway. We've heard it directly from affiliates here, how governments, instead of really investing in the workforce and solving the kind of staffing issues and the workforce issues, they're just looking to kind of outsource from overseas. And I think unions really need to be in the forefront of any kind of bilateral agreements that are happening to make sure that any workers who are coming in to work within care are having access to their full legal rights. Thank you so much to everyone for kind of joining today's meeting. I hope it's been an interesting and kind of exploration of kind of the situation within long-term care. I think it's really amazing to hear all the hard work that our unions are doing and how they're on the front line of kind of pushing for social dialogue and collective bargaining in this quite difficult sector. Long-term care has huge issues. It's poorly kind of unionized. It's highly privatized. There's a huge range of employers, from private, from public, non-for-profit and religious. So unions are really up against it when they're trying to advocate for the rights of care workers within the long-term care sector. So hopefully today's meeting has been a snapshot of all the work that different unions from around the globe are working in to kind of improve conditions for care workers. Thank you to the interpreters. Thank you to staff at PSI for all your work in getting this meeting together. I hope this is the first meeting we have of this kind. We really need to kind of increase kind of the visibility of the work that our affiliates are doing within social dialogue, within long-term care. Thank you so much to Merin for the ILO to kind of coming and to give their perspective. But I hope everyone enjoys the rest of the International Day of Care and Support. And please do keep in touch with any of the examples that we have. We will share this recording around, so please do share it with your colleagues or with other activists within your network. But thank you so much, everyone. I hope everyone enjoys the rest of their day. Bye.
Thank you very much. Have a good day, everyone.
Bye. Bye.